I would like to introduce Professor Stephen Williams. Professor Stephen Williams did his whole medical career at one of the most prestigious Ivy League universities like the Yale Medical School, and he did his medical training and his training as a plastic surgeon. He later moved to California, where he was one of the first surgeons in performing microsurgical breast reconstruction over there in that region. And he has been working with the ASPS in different committees, and currently he's the vice president of for memberships of the ASPS. So to us, it's a great honor to have Stephen Williams as a visiting professor to our plastic surgery training program, and we really hope to have him in person next year, so we can have the opportunity to show him something about Argentina, about Buenos Aires, which is also called as the Paris of South America, and yes, where we have great wines, the best steak, and the best tango of the world. Thank you, Stephen, and welcome.
Thank you very much, Dr. Mayer. It's an honor to be speaking in front of you and your residents, your trainees. Some of the talks that we do are much more technical, much more about surgical technique or new procedures or old procedures. But I wanted to talk a little bit today about private practice. And so let me see if I can share my screen. And this is designed to be an informal talk. And so if people have questions, please stop me. I'll try to reserve some time at the end to answer questions about it. Let's see here. One second here.
Dino, are you able to share your screen, Stephen?
I am. I'm just setting up. I'm sorry. I'm a little bit slow. There we go. All right. Can you see that now?
Yes, we can see it.
Okay, wonderful. Thank you. So I can't see you because I'm used to doing this in Zoom, but these are unfortunately the downsides of modern technology. So like I said, I'll try to kind of get through this relatively quickly. If you have a question, just verbally stop me. I'm happy to answer them. And again, I'm sorry that I'm not able to actually do this talk in Spanish. I understand a little bit of Spanish, but it would be an embarrassment for me to try to do it in Spanish. So I appreciate the accommodations. So what I wanted to talk to everyone today about was starting a private practice. And it's one of those topics that I feel doesn't get enough attention in residency. We're focused on becoming better doctors. We're focused on taking good care of patients, on surgical techniques. But sometimes we're left without a good skill set once we're done with training. And obviously, a large number of trainees stay in academic medicine, and that's wonderful. In the United States, we have large group practices too, but there's still a substantial number of plastic surgeons worldwide that say, I'm going to do something on my own or do something as smart of a smaller private practice. And so that's what I wanted to talk to everyone about today. My disclosures, I'm on the board of directors of the American Society of Plastic Surgery. I'm vice president of membership, and I'm also a section editor in technology for PRS Go. A little bit of a brief history about plastic surgery. We all know that plastic surgery itself has very deep roots. As early as the 6th or 7th century, plastic surgery techniques were being developed. In the modern era, the more modern era, plastic surgery developed really based on wartime needs. And so Harold Gillies in the First World War developed techniques to save soldiers on the battlefield. And it was those innovations that made cosmetic surgery more mainstream in the 1920s and 1930s. And then since that point, there have been more advances. In the 60s, 50s and 60s, plastic surgery went from flat-based and skin-based techniques to actual implants. So silicone breast implants became more popular and a thing. And then in the more modern era, non-invasive techniques and treatments have become a very important mainstay in cosmetic surgery. So neurotoxins, hyaluronic acid, injectables, non-invasive body contouring treatments, laser, those types of things. And then even more recently, the digital era is really upon us, and it's changed the way that we interact with patients. It's changed the way that we educate. It's changed some of the techniques we use in the operating room. It's changed the way we keep track of our patient records, documents, and the back end of plastic surgery in general. And so all of that said, why be a plastic surgeon? And for this audience, it's a silly question. It's too late for you guys. You're already kind of on the pathway. You've already made the sacrifices of the education, of the time, the sleepless hours, the learning. But for most of us, the reason we become plastic surgeons is it's the most interesting and creative of all the medical fields. It's the one that presents the most challenge. It's the one that has the most variety. We operate on every single stage of life, from neonatal to the elderly. We operate on every single part of the body, from essentially the concept of it's the performance of surgery on the skin and its contents. There's nothing that we're not trained to do, which I find incredibly powerful, and I know that's a large motivation for why we all become plastic surgeons. And then also, it's the most competitive. It's one of the most competitive residencies globally. And in the United States, we have a board called the ACGME, and they are responsible for accrediting residency programs. And in the U.S., there are 54 accredited residency programs with a total of 205 residents. And if you compare that to pediatrics, for example, they have over 200 programs and more than 9,000 active residents. And so for a lot of us, for people who are training, for people who are plastic surgeons, that competition, that strive to be the best is reason in itself. And so we've committed to this course, we've committed to this life of operating on and serving our patients and operating on the skin and its contents. There are different models in ways to do it. And I've hinted a little bit about some of those models previously. Academic, obviously, large group practice in the United States is becoming more and more popular, but still the majority of plastic surgeons globally are involved in some sort of private practice. And private practice is, in some ways, really its own independent concept. It has its independent challenges and benefits. And I feel residents, trainees nowadays don't really hear enough about that, and sometimes step out eager to start a private practice and are in some ways uninformed. And so I wanted to spend a little bit of time today talking about that. So the first thing after you finish your residency and you're considering private practice is, do I need more training? And sometimes people think about private practice in terms of just aesthetics, and that probably is the majority of private practice, but it doesn't have to be. Obviously, additional training in the form of fellowships is always available. In the United States, we have accredited fellowships in microsurgery, craniofacial, hand surgery, burn, and then aesthetic fellowships as well, too. For private practice plastic surgery, it's really more typical that microsurgery or hand surgery are the fellowships that people pursue if they're going to go out in private practice, or obviously aesthetics, because again, that's the bulk of what practitioners globally do in private practice. Starting a private practice when you're a specialist in microsurgery or hand, in the United States at least, is still very doable because it involves a lot of the same marketing techniques, a lot of the same communication, and it doesn't necessarily require all of the support team and associated specialists that are involved with craniofacial, pediatric craniofacial surgery or burn surgery, where you have to have intensivists, you have to have speech pathologists, you have to have neurosurgeons. You really require a team. For hand surgery and micro, you can really build a private practice alone. That being said, and I'm happy to answer more questions at the end, but that being said, I'm going to focus primarily on cosmetic private practice, but it's important to know that private practice can mean a lot of different things. So once you've finished your residency and once you've decided whether you're going to get additional training and fellowship, you find a location, you have to start building resources. And part of it is hospital privileges, a place to operate. You have to have an office. You have to have insurance and coordinate those more administrative things. But I want to really emphasize that it's important to get the certifications that are available for you. Certifications are that endorsement from the local government, from the national government, from your institution when you graduate from residency, from societies, professional societies. Each one of those certifications is an endorsement. They're saying, yes, this person meets those standards that are important for taking good, safe care of patients. They're part of a club that only lets in the best, most well-trained people. And those certifications are a message to other physicians and to your patients that you work hard, you're safe, you're well-trained, things that you already know, but the public may not understand. And so when you're going out into private practice, it's really important that you take those steps, find those certifications, and make those connections. You have to build a team. When you have your office, it's not just going to be you. You have to have an administrative staff. You have to have a clinical staff. You have to have a referral basis, and that may mean teams at a local hospital. That may mean forming relationships with other providers in the area. And then you have to build connections, and that's where professional societies come in, and that's where they're really important. These societies have resources for people starting out in plastic surgery. These societies have a template and a model. Here in the United States, ASPS, and also internationally provides resources for things like patient consents or what business model you should set up or how to find administrative staff. And so those connections are really important, and you can start making those connections now. So again, for cosmetic surgery, the world is incredibly diverse. There's a lot of variety in plastic surgery, which is why I think a lot of us pursue plastic surgery, why a lot of us are plastic surgeons. It's a global phenomenon. It tends to be increasing. The breakdown still tends to be the majority of cosmetic procedures are breast and body, and with face being probably second. Fat grafting and liposuction continues to gain over time. Breast augmentation with alloplastic materials and fat grafting now continues to rise. And when we look at a breakdown by country, we can see that it's really a relatively globalized phenomena with small difference trends. So for example, in Japan, there's a lot more attention to eyelid surgery and nose surgery and less attention to body. But ASPS has said, in Argentina, many more breast surgeries, many more liposuction and abdominal surgeries compared to other places. So it's important to recognize national trends within that global context. And the reason these things are important is if you're going to be in private practice pursuing cosmetic plastic surgery, or if you're going to be in private practice pursuing hand surgery or microsurgical reconstruction of the breast, it's important that you understand what the demographics are for those particular procedures. So the main thing that residents come to me and ask me about is growth. How do I build my practice? How do I create a successful practice? And as was mentioned before, I started out actually primarily doing reconstructive plastic surgery with a large group practice, and then kind of pivoted into doing reconstructive surgery primarily of hand and breast reconstruction as a private plastic surgeon. and now have evolved. I still do some hand. I do some breast reconstruction, but 85%, 90% of what I do right now is cosmetic plastic surgery. But the growth pattern for any of those endeavors outside of an academic institution is still the same. In order to have that kind of growth in the modern era, you have to build identity. You have to tell a story, and you have to let your patients be the hero of that story. And what I mean by that is this isn't necessarily a new concept. In the 1950s, when you wanted to be a plastic surgeon, same concept. You had to let people know that you were a good surgeon. You had to let them know what your specialties were, what you felt comfortable doing, and you had to get that word out there. What's changed is the mechanism of how people are communicating that is radically different. In the old days, and I'm also old, I've got a lot of gray hair now that I didn't used to have, but in the older days, it was really about building a reputation, starting slow. You go to the emergency department, you meet surgeons, you meet, the mother of a child who has a facial laceration. And that was the way that you really kind of built your practice. And when I trained at Yale University, and I was under John Persing and Steve Arian, who are legends in the field, and I give a lot of credit to, they really said, cosmetic surgery or private practice plastic surgery isn't the ideal. You should only be an academic plastic surgeon. And I think that they've softened that position now, because in private plastic surgery, you can still do amazing things. You don't necessarily have to have the apparatus of that academia behind you. But what you do have to do is you have to build an identity, and you have to be able to tell your story. And so in the United States, we've noticed the progression from, I'm going to advertise in a phone book in the yellow pages where people look up, okay, I'm looking for a plastic surgeon. Let's turn to the plastic surgery section of the yellow pages to find out who to call, to newspaper and magazine advertising, and then the internet, which enabled websites and people being able to see before and after photos and learning more about yourself, and to now social media. And that's really the change. The techniques and the ethics about how we communicate and the messages we want to tell are the same, but the mechanisms we're doing, that we're using are different. And that's what I want to spend a little bit of time focusing on. So what's the nexus? What's that connection between patient and the tools we're using, the internet, and what we want as physicians, which is to attract patients, to be able to provide good, safe care, to have informed patients. And it's really that combination. Patients are now using the internet first and foremost to find information. That's where their search starts, and the internet really empowers that. And as physicians, it's important that we recognize that and are able to speak to our patients through that vehicle. So social media is really kind of the most modern force that people are using. And it all still centers on having a coherent website, because that website is your home on the internet. It's where patients can find out more information about your certifications, more information about the procedures, more information about your before and afters. And when they search, they still use your internet to find that. But increasingly, it's these social media platforms that empower physicians to reach more people more quickly. And that's been a catalyst in the transition about how we communicate with patients. And sometimes this change is a little bit painful. And I do think that older plastic surgeons like myself sometimes have a little bit more resistance and a little bit more fear about what does this tool, what do these new platforms do to undermine the serious nature of our relationships with our patients, the ability to provide honest information. But in the long run, it's what has to happen. It's what the patients want. It's where society and where internationally things are going. And so social media continues to grow as a tool. There's the data from the Pew Research Center, which is a major research body that performs a lot of studies like these, shows that the utility that people have. On the left, I have graphs from data from 2018, and on the right, from the same research study, data from 2020. And you can just see Facebook, Snapchat, Instagram, Twitter, not only have they maintained their dominance in how people are using them, but people are using them even more frequently on a daily basis. Their growth has increased that much, 20%, 30% more U.S. adults on a daily basis are using these tools. 30% growth over 3 years it's insane. It's really just an astonishing amount of growth. And it's really a signal to us as plastic surgeons that this is the mechanism that patients are going to continue to use to find out information about us as plastic surgeons, about our private practices, but also just as a source of information. So in 2013, the Plastic and Reconstructive Surgery Journal found out that about half of U.S. plastic surgeons are using social media to market their practice. And in 2020, that number is almost 3/4 at this point. And so when we're thinking about plastic surgery and using social media, how do we do it? What's the safe way to do it? What's the responsible way to do it? And how do you ensure growth? The website is where things start, because that website is that home. That's that nexus that patients can return to or go to find more information. But it's important that we use multiple channels. And so we use Facebook, Twitter, Instagram is probably the biggest channel we use. But it's important to use multiple channels because the social media environment can change over time. It's your website that has that consistent message. And it's important to represent multiple aspects of your practice, not only the procedures you perform and before and afters, but things about your qualifications, things about your certification, things about what it's like to come into your office. So patient expectations for social media, it's important that as you're reaching out, the things that you're doing online are ethical. The things that you're doing are honest and convey effective information about risks, benefits, and alternatives. And so when we're thinking about those rules that good plastic surgeons follow, we also want to understand what the patient expectations are. And again, a Google search or an Instagram search or Facebook search is usually where the modern patient starts. And social media platforms, again, from a study from Larry Fan from PRS in 2019 shows that they're becoming more and more influential, especially for non-invasive types of procedures. Patients are expecting to see before and after pictures. Patients are expecting to see other patient stories. And the roles of influencers and the outsized role that social media platforms have is increasingly influential in what your patient expectations are. And that has good and bad aspects. And we'll get into that in a little bit. So when we kind of try to get a granular idea of what patients are expecting, the majority of patients from this study said that they prefer not to see lots and lots about a surgeon's private life on social media. They were evenly split about whether they wanted to see graphical surgical images. And the really shocking part is 96% of the United States general public was unclear about what type of board certification a plastic surgeon should hold. And again, it kind of points to another problem about social media and the internet is it lowers the bar to entry. It lowers the amount of work and effort people have to do to get attention. And that creates confusion. And that's in some ways independently a reason why it's important that board certified plastic surgeons that are doing things the right way continue to have a voice on social media in some ways to push back against other practitioners that maybe aren't being as responsible because patients can get hurt. So these are some different posts from some of the things we've done. And again, I have a balance of reconstructive and plastic surgery reconstructive and cosmetic surgery with the majority of it being cosmetic. But we try to place these patient communications into different sections. And one of them is patient education. And so we do posts about breast reconstruction, about techniques that we use for hand reconstruction, and as well as for differences and changes we've made for our cosmetic procedures. We also have patient recruitment. So we have patients that we've treated and we do posts about them and tell their stories. It's important when you're engaging and using social media as a tool, it's important to tell the patient's story. One of the successful parts about messaging and about building a brand is having it being about the story. The most effective type of messaging comes when you're not saying, I'm Dr. Williams and I went to Yale and I'm great and you know, aren't I so special? But it's about saying those certifications, those qualifications, this journey that I've made as a plastic surgeon helps to empower you. It helps the patient to achieve what they're looking for. And again, not just in cosmetic surgery. It can be in hand surgery or breast reconstruction. It has to be about that patient being the hero of the story you're telling. And one of the ways I always think about when we're trying to tell these stories is a classic movie from the old days in the 1970s, Star Wars. You know, Luke Skywalker is the hero of that story, but Obi-Wan Kenobi, this old teacher who shows him how to use the Force and trains him, he's, in our situation, he's the plastic surgeon. The patient is Luke Skywalker. The patient is the hero. It's our job to empower that patient, to use what we know to get the patient where they want to be. Patients will really respond to that type of messaging. Advocacy obviously is an incredibly important part of my life as a private plastic surgeon. And sometimes people think, well, you know, once you go into private practice, it's all about money and cosmetic surgery, and you walk away from that advocacy. And increasingly, the opposite is true. Private practice plastic surgery enables you to use resources that you independently control to really fight for patients, to fight for causes that you believe in. And advocacy is increasingly important. And I would implore you, as you go through your training, as you exit your training, really think about giving back. And just because you're not part of an academic institution doesn't mean you can't play an increasingly large role in terms of patient advocacy, in terms of advocacy for plastic surgery as a profession. And then lifestyle. Patients want to know a little bit about us. And again, we don't spend lots of time showing the cars we drive or where we live or things like that, but we do tell a little bit about lifestyle issues in the practice, or kind of what led us to become plastic surgeons or part of our training. And so on the left side is a letter from United States Senator John McCain, who I worked with for a period of time and recommended me for the Naval Academy. And I didn't go to the Naval Academy. I stayed in civilian life and went to Dartmouth College and then Yale. But that type of expose into what made you a plastic surgeon, or what your certifications were, or people who endorsed you as a serious person, as an honest person, as someone who is going to work hard and achieve goals at any stance. Patients want to hear those stories because they want that for them. That's who they want on their team. And then before and afters, and that is probably the most obvious direct use of social media. And again, it comes with pitfalls. It's really important that people are professional. It's really important that patients understand how you're using before and afters, and that they give consent, and that we're not taking advantage of patients or being unprofessional with the gift that these patients have given us, which is to allow us to treat them. But these are incredibly important and increasingly important parts of what patients expect to see when they're interacting with private practice plastic surgeons. And again, these are cosmetic examples, but it doesn't have to be. It can be, we have examples of breast reconstruction, we have examples of hand surgery we've done. In the private practice plastic surgery realm, it's part of building your brand and you're building your identity. So when I'm doing these stories, what do I bring when I'm shooting in the OR? What do I bring to clinic? I start with a plan. I want to know what my message is. I make sure that I have patient consent, that I explain to them, this is what we're going to be doing. We're going to be taking these images or these videos and where they may be, because once you put that piece of media or material,
implant rupture,
once it's out there,
old generation silicone implants,
it's out there forever. And then we use kind of high-grade cameras. We have dedicated media professionals. But what's most important is it's always important that you're professional. So once you do all this, once you're doing all this work, it's important to measure your progress. And that can be in a bunch of different ways. One of the things we love doing is just asking our patients, hey, why did you come to see us? Why do you think that we're the practice for you? Why do you think that I'm the surgeon that should help you with your breast reconstruction or should help you with your tummy tuck? Patients will be incredibly candid, and they'll tell you exactly the things that they liked about your messaging and about your brand and your identity, and the things that they don't. You can also interact with patients on social media. You can follow increases in influence in terms of how social media is occurring, what media attention you're getting, what your website traffic is. But the bottom line is you get to measure how many patients are coming to see you, and are they saying positive things about what your messaging is. It's incredibly important that you take those moments and you listen to what not only patients are saying, but other professionals around you, because that's part of your identity as well too. And then make course corrections as you go along. So it's all a lot of work. And as residents, I know that you're not afraid of doing hard work, and hard work is kind of part of what's in your DNA. But it's important, and a lot of, in the United States anyway, a lot of this messaging and this communication started in the 70s when the Federal Trade Commission, which is the body that regulates advertising, ruled that doctors of all types can advertise. And that was really the start of, at least in the United States, how this has come about. And again, it has good things and bad things. Advertising can be incredibly erosive or corrosive and can send the wrong messages and can mislead patients. But when done well, it can serve as a tool that really helps to educate patients, that really helps to spread messaging and recruit patients for that you can help care for. So what do our patients say when we started doing these types of stories, when we started really building a brand identity on social media? They to us and they say, I feel like I already know you. I've been following you for years. I know your patients. I know your office. I know when you've brought in new team members. I've seen so much of your work. I know that you do great work because I've seen what you do online. I've seen what you do for patients, and that patient is me. That's who I am as well too. And they also say, I feel like I understand the procedure more. Classically, all of us, when patients come to us now, we hear the same phrase. I'm here to see you about whatever the procedure is, and I've done my research. What that really means for most patients is they spent 5 minutes on the internet, they've Googled it, they've gone on your website, or they've gone on another website, they've gone on social media. And it's important to, in our practice, and I think globally, it's important that plastic surgeons affirm that that's important, that patients should feel empowered and that they should use the tools at their disposal to do research. But it's also important that patients understand that social media and the internet only provides a limited amount of information. We try to put out the best information possible. We try to put out representative examples of what we think we can do for patients and what their stories are. But it's also important that those patients understand that it's just the beginning of the messaging. Because there's so much of it out there, it's increasingly important that the good guys, people like yourselves, people, board-certified plastic surgeons in the United States, that our voice is increasingly a part of what's out there for patients. And that kind of leads me to some of the downside. Social media platforms, their algorithms, the reason they work, the reason they make money is because they thrive on controversy. They thrive on vitriol. They thrive on outrage because that's what gets interactions. That's what gets people looking at them. And so when we looked at a study came out from Dorfman, who was a resident, by the way, and was published in the Aesthetic Surgery Journal, they looked at almost 2 million posts, and they found that only 20% of those posts in the United States were from board-certified plastic surgeons. And part of the reason why is it's not just us that understands the power of this. And while plastic surgeons try to be responsible and consider the ethics of the message and consider risks, benefits, and alternatives and try to educate patients, not everyone takes the high road. And this clip is from a dermatologist in Georgia who became very popular online because she would dance while doing liposuction and fat transfers. And it showed a total disregard for the patient-physician relationship. Technically, it was, as a board-certified plastic surgeon, it was appalling to watch just from a technical standpoint because there were sterility breaks, there were technique breaks, and this physician had very poor outcomes. But the social media algorithms rewarded the outrageousness of it. And they rewarded the fact that this was a dermatologist doing things that we think should only be done by plastic surgeons. And it was in some ways that outrageousness that made her famous. And she correctly realized that famous, infamous, it's all the same thing for when you have no ethics, because it's about building revenue, getting patients in the door. And so that's one of the problems with social media. It's incredibly concentrated. The barriers to access to getting the message out are incredibly low, and it allows physicians of all types, not always the best, to use that corrosive algorithm to generate revenue. And when that happens, patients get hurt. This particular physician fortunately has had her license removed now, but it was only after dozens of patients were injured and had poor outcomes, and it's not what we want. And so I kind of contrast that with kind of the respect and reverence that I think most plastic surgeons try to bring to social media, and try to use it as an educational tool, try to use it as an inspirational tool, and really have that respect that is bred into us from medical school, in residency, from our teachers, from the surgeons that we look up to, about how powerful plastic surgery can be and how innovative and how much it can change a patient's life. It has to be our voice when we're out there communicating, because otherwise we get the opposite. So I'm going to step away a little bit from social media and talk about just kind of some things that I wish I knew when I was a resident and when I was training. We all go into surgery because we like operating, we like spending time in the operating room. The interesting thing is, as a private plastic surgeon, and I think this is true in academia too, the amount of time I spend in the operating room is actually a minority of what I do in my practice. And that's not necessarily a bad thing, but it does kind of create a little bit of a reckoning. As a resident, I probably operated more than I do as a private practice attending. I'm operating today. I have 4 cases. I generally do about 10 to 15 cases a week, but we're a really, really busy plastic surgery practice. Not everybody is quite that busy, and we spend a lot of our time answering patient questions, which incredibly important. Spending time talking to patients, seeing preoperative visit patients, seeing postoperative patients, managing complications. Every good plastic surgeon has complications. Part of what makes a plastic surgeon good is how they treat those patients afterwards. And so that's a major part of the time that you're going to spend outside of the operating room, is guiding those patients to make sure that they get the best care possible. When you're building your team, you're trusting people. You're bringing people in that hopefully share your ethics, share your vision on how patients should be treated, share your expertise and excellence in terms of what you can provide as what you can do as a medical provider. And that means that when you're building your team, you should hire people slowly. Really make sure that you understand who they are. Make sure you understand what their objectives are. Understand how they can help you. And if you need that particular person to help with your practice. And if it's not working out, fire them quickly. Say, I'm sorry, in a respectful way. But say, I'm sorry, I don't think this is a good fit, and move on. The hardest part of my practice, people always say, well, what's the hardest part? It's the team, believe it or not. It's making sure that the team is incentivized, making sure that they're providing good care, making sure that the standards are adhered to. And not to say that we bring in people who can't do that, but it's a constant effort to build systems around those people so that they can thrive, they can grow, and they can accomplish the mission of taking good care of people. It's a lot of work. And this is probably something that maybe people know, but maybe they don't. But surgeons that are liked, surgeons that are friendly or perceived as friendly, both from their patients, from the staff, from their colleagues, from the professional societies, they have an easier time of growing and of progressing. And the reason why is people see patients, other plastic surgeons, people see people who say, you know what, that's a really nice person, or you know what, that person's working really hard and trying to do the right thing. They're more likely to join your team. They're more likely to say the right thing or help you when you need help. And we all need help at some point. From a patient standpoint, if physicians are arrogant or angry or don't spend a lot of time communicating, then patients say, I feel like they didn't take time to listen to me, or they were in a rush and that's why I have this problem. Being nice, being likable is actually an incredibly important part of moving forward. And then managing expectations. And this is a little bit about, again, a little bit of the power and the problem with social media. Body dysmorphia, that kind of perfect look, that life is always ideal and the best, is one of those things that social media and these algorithms kind of feed on. It's that self-doubt, that discomfort in one's own body that social media kind of feeds. And I found these posts fascinating, and there's increasingly better literature about it, that, kind of Instagram and kind of that picture versus what the reality is. And the challenge is, especially among young women, social media is incredibly corrosive in terms of body image and body dysmorphia. And there's this concept that it always has to be perfect, and I'm supposed to look good all the time. And even the word good is a little bit strange. I have to kind of adhere to this unattainable standard of beauty that, number one, isn't realistic, and number two, isn't even real. And I tell my patients that all the time when they bring in, a supermodel who's posing. They say, I want you to make me look like this. And I say, you realize that I can't do that because even she doesn't look like that. She is, it's either a little bit of digital editing, or it's just that one perfect pose and that perfect lighting, or it's professional photographers. I try to tell patients that we want them to be empowered. We want them to look the way they feel on the inside. But there's a line between autonomy and control over one's body and being able to self-actualize and pursuit of things that aren't realistic or aren't normal standards. And so managing those expectations is a large part of what we do when we interact with patients. And especially when you're going into social media, it's important that you understand that as a tool, incredibly powerful in terms of getting messaging out and getting education out and being a responsible surgeon. But the tool itself is flawed. And the tool itself, again, is built around outrage and impossible standards of beauty, especially in teenage girls and young women. The effects are especially corrosive. So the last thing I want to end on is part of private practice plastic surgery is that a lot of times you have to manage these challenges with more limited resources. And the global pandemic, the coronavirus, is an example of that. So our patients want safe surgery. As physicians, we want to make sure that we're focusing on things that are important. And so there was a period last year where we actually stopped doing cosmetic surgery and focused more on trauma reconstructions, breast reconstruction. And we made ourselves available. We actually made our surgery center available. We had our ventilator on call to the local hospital in case they needed it for COVID patients. And so even though you're in private practice, it's important to realize that you're still a physician and you're a global citizen. And when these global events happen, it's important to realize that you will be called upon, and it's your job and your duty to step up and to continue to support your patients and to help medicine as a whole and patients as a whole where you can. And as a private plastic surgeon, that may mean different allocation of resources. It may mean that staff are doing different things to support kind of a new temporary mission. And then encroachment, I talked a little bit about this, but the fact that social media is so powerful and the fact that the internet and social media is really a tool of growth for private practice surgeons and plastic surgeons in particular means that everyone's trying to use that as a tool to, in some ways, be dishonest and in some ways to trick patients into devoting resources, devoting money into something that maybe isn't right for them because they have a lower standard of ethics, they have a lower standard of expertise because for them it's about generating money. And so when those things happen, it's important that we hold our ground, that we occupy the space because it has to be our voice as trained plastic surgeons that are setting the bar for the ethics, that are setting the bar for the level of care. And so in the end, it's kind of about very simple things. And it's kind of quotes from Hippocrates and Shakespeare, first do no harm, to thine own self be true. And perseverance is the hard work that you do after getting tired of doing the hard work you already did. And so I really appreciate everyone's time and allowing me to speak to you about a topic that I actually think is very important. And so with that, I'd be happy to answer any questions.
Well, thank you, Stephen, for such an inspiring talk for our residents. I think it's a wonderful message that you just gave. We are, besides the pandemic, we are dealing very hard times. Our specialty, as you say, that figure that just 18% of all messages and social media related to plastic procedure are actually plastic surgeons. So it's amazing how other doctors from other related specialties are doing plastic and cosmetic surgeries nowadays. All around the world. It's not just a problem in the U.S. Yeah. I know that the California state has done a wonderful job. I know that they banned the doctors. They are gathered in the association that is the American Academy of Cosmetic Surgery, and I know that the California state has banned the possibility of their presenting as cosmetic surgeons or plastic surgeons. And I know that society is gathering people from ENT, head and neck surgeons, gynecologists, dermatologists. So they are gathering, and actually they are a true scientific society that they hold their annual meeting every year, and they have thousands of members. So I would like to know if I have some colleagues in Europe. They are very pessimistic about the future of our specialty. I mean, there are so many physicians from other specialties that are claiming, to perform the plastic surgery of their own anatomical region. So we have ophthalmologists that they want to be oculoplastic surgeons, gynecologists that they want to be breast plastic surgeons, orthopedic surgeons who wants to be orthoplastic surgeons, and you know, so every year there is a new society. So there are people in Europe that say that perhaps in 10 or 20 years our specialty is not longer exist, and the other surgeons are gonna perform the plastic surgery in their different regions of the body. Which is your feeling about that, or your thoughts about that?
Yeah, thank you. It's a really good question, and it's something that you know, as a private practice plastic surgeon, we combat every day. ASPS battles that, and it has a lot of advocacy efforts around trying to reverse some of that trend. But I think the phenomenon is real, and it's driven by finances. It's a money issue. The reason that these specialists, these other practitioners want to do plastic surgery is because they understand the reimbursements better. They understand that they can avoid insurance compensation, which, especially in the United States, tends to be much, much smaller than cash pay, what patients are willing to pay. And so part of it is there's that motivation that will always be there. And then so in some senses that kind of that thought that, well, it's going to be a problem that may overwhelm us, there's a real risk of that because that motivation is there. However, there is also real clarity that training for plastic surgeons for the procedures we do is better. Our outcomes continue to remain really strong. That societies internationally are recognizing this as a threat and are making things, participating in more advocacy to really make sure that the message is out there. And then also patient education about what it means to be a plastic surgeon and what that empowerment is. Part of what we need to do as residents and what I try to do as a plastic surgeon is I try not to abandon any ground. And what I mean by that is even though my cosmetic procedures probably create better finances, more money for my practice, we still do reconstructive surgery. If we get called by an ER to come help, a child or have a mandible fracture or something like that, we'll still do it. Because I know if we don't go in, then the oral maxillofacial surgeon will say, I can definitely fix that mandible. And the minute you see part of the reconstructive ground, it becomes easier for those groups to say, well, if they let us do the reconstructive, then of course we can do the cosmetic part too, because what's the difference? That's actually a legitimate argument, I think. And so it really is on us to occupy all parts of our specialty, to not walk away from patients that need us because maybe there's not as much financial incentive. Now, that doesn't mean that you never grow or you don't try to do more things that you're good at, but you have to be an advocate for the patient. You have to do the things that maybe aren't as glamorous sometimes, because otherwise that's these other specialists' door in.
Yeah, it's a problem. The other thing also that the other scientific societies, they are not so strict regarding ethics in publication and social media. And for instance, in Brazil, the National Society, it doesn't allow the Brazilian member to post pre and post-op results.
Right.
But all those surgeons that are outside the society, they are free to do that. So it's not fair competition, So it's a problem.
No, I agree with you. I think it's something that hopefully is evolutionary. I'm hoping that, and it's not just Brazil. There are other places in the world where there's that same problem.
Yeah.
And you can't silence the good guys. You have to let us be able to, again, within what's ethical and within what protects patients, you have to allow us to occupy that space, because otherwise all the bad actors come in, and then patients say, oh, plastic surgeons, they don't do liposuction. It's only the general surgeons or the ENT doctors or the gynecologists that are doing it. And so I'm a very strong advocate of being ethical. I'm a very strong advocate of patient education and of advocacy. But at the same time, we have to be allowed to use these tools, because otherwise that vacuum of responsible voices allows patients to get hurt.
Right. Yeah. Right. This is we always must think of the patient first.
Yes.
Not put the money before. And unfortunately, some people don't think in that way, and is, as you perfectly say, it's all about the money, and that is the sad part of the story. Is not the most prepared and the more trained person who is performing the surgery. Who is another one is just because there is another way. There is no other explanation. I always say that if this patient were your sister, would you allow this surgeon to perform the surgery? Say no. I'm gonna look for a plastic surgeon. So that is the main difference. We have a question from Robertino Basso, who is our chief resident. Go ahead, Robertino. You can talk.
Okay, first of all, thank you, Dr. Williams, for being here. It's a real honor for us to hear a talk from you. And it's related about Dr. Mayer, and you said, I would like to ask you about if there is any regulation from the ASPS regarding social media content.
So very good question. And again, I think it goes to what Dr. Mayer was saying earlier, is that plastic surgeons are still bound by rules of ethics. And so the ASPS looks at social media messaging in the same way they would look at a newspaper ad or anything else. There's no exception to ethics just because it's on social media. In addition, it's not only ASPS, but it may be state and local societies. It may be state regulators and federal regulators. In the United States, again, if we're paying to have someone promote a post for us, by law, you actually have to state that this person has been paid. It's essentially a commercial and not just a testimonial about something that happened. And so there are a lot of rules. Now, again, also as Dr. Mayer has pointed out, it's the bad actors that don't follow those rules. And so what we need to do as plastic surgeons and what I encourage the professional societies to do is to have advocacy that those rules and laws are enforced against people that are doing things that are unethical, that are doing things that are dishonest. Even though these social media platforms are built on more of the scandalous types of posts, the things that are typically less ethical, we can't go down that pathway. And so what we have to do is we have to continue to fight the good fight and be ethical. But to answer your question directly, yes, the ASPS still expects all of its members to abide by putting the patient first, by protecting patient privacy, by being ethical, and by being honest. And that is essentially in every aspect of practice.
Wonderful.
Thank you,
Steven. I have another question, regarding you were talking about managing patient expectations regarding results in social media, and which is your opinion about the use of those simulation softwares to simulate results, and in that way, you are in some sense, you are offering results and promising results.
100%. And so it's a very good question. I used to, when I was in medical school, I actually had a technology company, and we were primarily doing electronic medical records, and we created software for Kaiser Permanente, which is one of the biggest group practices in the United States. And so I was and I still to this day remain very committed to technology. I think technology is incredibly empowering, and it's a tool that scales up. And so as our needs as physicians and needs as patients increase, technology is a wonderful way to solve that. That being said, I'm very cautious to use those tools. And when patients come to us and say, can you just Photoshop what my nose would look like? Or can you use, the other plastic surgeon I saw uses software to show me what my breasts are going to look like. I tell my patients that we can do that, but I think it sometimes presents a dishonest or potentially an unrealistic expectation, because I tell them on the computer I can make you look however you want, but that's not what I can do in plastic surgery. When our patients come to us, they say, well, you're the artist, just make me this work of art. I say, well, that's not really how it works. The first and most important thing is that we provide procedures and treatments that are safe, because you're not a piece of clay. You're a living human being, and there are consequences to everything we do. And when on a computer, those consequences don't exist. And so in my practice, I try to avoid doing a lot of simulation software. What I do is, we do a lot of digital photography in our office, and I actually, it kind of shows, again, a lot of gray hair here. I actually physically draw on the picture. And so if someone says, show me what my waistline will look like after liposuction, I'll draw what I think I can produce. I think that drawing gives patients enough of an idea about what an expectation should be without giving them this specific visualization that may lead to an artificial expectation. And we use that picture a lot of times when they come back. We'll take a post-operative photo and I'll be like, let's look and see how close we were compared to the drawing. And they'll say, oh, it's even better than the drawing. I'm like, yeah. It allows patients to understand a little bit about that there's some variability, that it's not an absolute picture. And I think especially in these days of social media and these days of imagery being everywhere, it's really important to kind of draw that line and say, well, wait a minute, this is surgery. And the first thing is doing things that are safe. And I can't necessarily create whatever your ideal is, but here are the things I think we can do.
Right. I totally agree. We are using simulation program here to create molds for shaping autologous breast reconstruction, the flap. But we never show the simulation result to the patient. We just use it to create the mold, in order to, because in breast reconstruction is even, the task is even harder, to achieve symmetry, and it's very dangerous. The other thing that I would like to ask you is, have you done any calculation about your conversion rate, about people who contact you through social media? I mean, from those patients that contact you requesting a consultation or doing consultation through social media, which is a percentage of these patients that actually undergoes surgery with you?
Absolutely. And so in private practice, you become a statistics expert. You're looking at a lot of data about, how well you're doing with your messaging. And, again, financially, it's a really important thing to consider, but it also translates into how effective you are about sending a message and how well heard the things you're saying are. And so it's an important thing to look at. What we found is patients that are referred by former patients or by former family members, those are the highest conversion, almost 70, 80%. And the reason why is if someone that they trust and know sends them to us, they're very serious, and they already, again, have that certification, that blessing that says, you took very good care of my sister. I know you're going to take very good care of me. The second highest conversion referral rate is social media. And it typically is the patient that has followed us for a long time or has interacted with us for a long period of time, because you're establishing that relationship early. When I see our patients, we try to spend as much time as we can, but in all honesty, it's usually probably about maybe 20 minutes of actual face-to-face time that I'm personally spending with a new patient. And in some ways, that's really not enough to make a really large decision. And so we try to use social media as that extra point of contact, as that extra point of familiarization. It's not a great tool for specific questions about risks, benefits, alternatives for that particular patient. But it is a very good tool in terms of generally what happens postoperatively. Generally, who am I going to talk to when I come into your office? Generally, what does the office look like? Those things make the patients much, much more comfortable. And we've found contribute to a substantially higher conversion rate. And so patients that come in through our social media channels that have followed us for more than a month, we're typically converting at a 50% conversion rate, which is, again, much higher than anything else.
Right. And my last question, there is another one from our residents, but I would like to ask you before. Do you think that the social media has really changes our practice in the point that a resident finishes his training or her training is much easier to start working by using social media that, before, about 30 years ago or 40 years ago, a surgeon need to work very silently, very hard work to gain reputation, to finally start working. And nowadays, you have a good photographer, you have good models, and you can start working right away. Which is your opinion?
100% true. And for people like myself, again, I'm not a young plastic surgeon anymore. I just turned 50. I've got more gray hair now than I used to. In some ways, my training was the opposite of that. My training was in the old model. You pay your dues, just do good work. You don't have to be flashy. You don't have to brag. You don't have to expose patient pictures. That's a little bit unsafe. It's not unethical, but it's a little bit unsavory. That's what charlatans do. Just work hard and you'll get there. That is 100% not the reality anymore. And I think people of my generation are still kind of coming to terms with it, because when I have a resident come and say, look at my social media following, I'm like, yeah, but you need to become a good surgeon first. It's probably a little bit of I'm probably a little outdated in my thinking. I do think that what's important is we recognize that things are different now and that social media is a tool. But what we need to do is we need to make sure that our trainees understand the appropriate ways to use it, the ways to educate patients, the ways to be ethical, the ways to provide information, and not just see it as I'm going to become busier than someone who's been in practice for 20 years. You may, and that's great, and that'll be still a great frustration to kind of the older generation. But the important thing is that the tools are used right. We have to empower the younger generation. I mean, part of the reason I love talking to residents is because they're the future, and it's important that they have the tools they need to move forward. And I think social media is one of those tools. But it's also my responsibility, my obligation to make sure that we're all using it responsibly and ethically, and we're doing honest things, even though that may not be the shortest pathway to becoming, rich, I guess, for lack of a better word.
Well, we have a question from Mario Currenti, who is a second-year resident.
Yeah.
Mario, can you talk?
Yes, doctor. Can you hear me?
Yeah. I can hear you. Yeah.
Go ahead.
Yeah. Well, first of all, thank you for the talk. And I want to ask you about another streaming platform, which is Twitch. What about that? Because with Twitch, you can reach the entire population instead of publication or static propaganda.
Sure.
With this platform, you have the possibility of streaming and for anyone to see it, not only those interested in plastic surgery. And I think that's the limitation of other platforms, which are conditioned by what the citizen consumes according to their choice. Not so with this platform that continuously updates its stream list. You can use a human model that agrees and raises the awareness among the entire population. And not only, like a doctor says here, sell illusions to the patient, but telling the truth in real life.
So I think it's a great question, and I'm familiar with Twitch. Twitch started as a gaming platform, really, and that's probably still what it's the most useful for. Pro gamers will, Fortnite, or I actually used to play StarCraft, so those types of games are streamed online. Yeah, I love StarCraft. But those games are streamed online, and that's where Twitch really kind of got a lot of its fame. The reality is, it's not necessarily the platform, it's how you use it. And the nice thing about Twitch is you're able to kind of build a community and build followers who are expecting to see a little bit more of that video interaction. And so for plastic surgery, streaming operations, those types of things make a lot of sense. Now, live streaming operations has consequences, right? If something goes wrong, that's, and even if it's something minor that it's like, well, there's a little bit of bleeding and we expect bleeding and we know how to manage it. Sometimes that messaging can get out of control because, again, you've now put that media out there, you have less control over it. And so I would just caution about making sure that the things that you're putting out there, especially if you don't have a chance to review them, just be a little bit careful about that. But I wouldn't focus as much on the platform because Twitch is popular now, but in 3 years it'll be something else. I think the real concept is think about how you want to use that tool. If Twitch continues to grow, which I think it will, they'll be acquired. Instagram was acquired. TikTok may wind up acquiring Snapchat. These platforms are so powerful and have so much money that they cannibalize one another. And if someone has this great feature, a bigger player will just steal it eventually. I do agree that Twitch allows you to form a little bit more of a community and kind of is probably better for showing things in real time, but it's just another tool.
Thank you very much, Doctor.
Thank you.
Great. Well, Stephen, we know that you have a very busy surgical day today. We are extremely grateful for your time, for your expertise, for your advices. They are very, very valuable, especially for our residents. Things are a little bit different here in Argentina, but in general, it's the same. So we are really honored and happy to have this opportunity, and we really hope to have you in Buenos Aires soon, next year, perhaps April or May, visiting our hospital, perhaps performing some surgeries, who knows? And
I would love that. That would be amazing. I would consider that a real honor. Speaking to you and speaking to the residents, again, I consider it an honor. It's wonderful that we have these moments, and that's one of the nice things about medicine in general is we're still all colleagues and we're still stronger together. And so this is something that's very valuable, and I consider a real honor to be invited. Thank you very much.
And also, you were talking about the strengthening relationship between the ASPS and the Argentine Society. Our chief resident, Robertino, was chosen as a recipient of the traveling scholarship from the ASPS.
Well deserved.
He's presenting.
Thank you very much.
He's presenting a work from our department during this Congress, so we are happy for him as well. So best wishes for your surgeries, and thanks again.
Thank you. I'm sure we'll be in touch soon. And if anyone needs me or has questions, I'm happy to answer them. Just find me online or call me. Thank you very much.
Thank you very much. Very kind of you.